easy fix for the dearth of robust quality measures? I have my bias here. So.
Okay, go ahead.
My bias is that based upon how we're willing to measure things and the amount of administrative burden that we're willing to take on to do so, I don't think we're really going to get to measures that matter. When you look at actually capturing patient-reported outcomes that matter to them, asthenia, insomnia, pain, depression, hopelessness, functionality, you have to think differently. And EHRs and billing data don't capture any of those things in a meaningful way. And even if you look at survival data, there's no way that tumor registry data gets connected to billed and paid data. So even if you're asking something as fundamental as, do more people survive when they're treated with X, we're hamstrung to do this. So, I mean, it either requires a radical re-envisioning or someone in the payer space to say, this is what we need. Or we're willing to pay more to get it.
Yes, so I think, there's lots of important points of data that we'd like to get, maybe date of diagnosis, date when the patient was staged, ideally, and date of death. So there's a lot of complicated administrative detail involved there, like you just mentioned. And I think to start with, process measures are great. At least we're trying to get the providers to focus on simple things first. There are some PQRS measures, there are some pain measures, there are some depression screening measures. Are they even doing that? Are they addressing the pain? Are they filling a prescription for pain? I think start there, and I think eventually we need to get to the measures that really matter, right? And we need to be able to get the data, we need to be able to measure them and go forward.
So I guess that I would look at this maybe slightly differently. I think defining quality measures is crucial if you have a metric that you want to move. And so I think the real question is not how do you define quality, but what quality measures do you choose to measure so that you can feed back to the system, to the physician, to the pharmaceutical industry, to the payer, so that you then want to modify or change behavior so that things improve. I don't think any of us want to measure something just to measure something.
Yes.
We want to measure something because we want to be able to figure out where we need to put resources and where we need to modify things. That it's a little bit of a modification of the Heisenberg uncertainty principle in physics, that the more precisely you measure something, the more you perturb the system. And so if patient-reported outcomes is what we want to perturb, then we should measure those very intensely. If survival is what we want to measure or be our quality metric, then we want to focus on therapies and what therapies are going to optimize or maximize survival. So I think the decision really is what metric do we want to move? And whatever metric we want to move is where we should focus.
I've never heard Heisenberg quoted in a medical talk, so kudos to you, Bob.
We'll move on to Schrödinger's cat shortly.
I agree with you. We have to be very thoughtful about what we measure, and does it make a difference to patients? Do patients care about that measure? And I think one area that we as a delivery system, in fact a region, have focused on is around end-of-life care and ensuring that patients have a conversation, not necessarily with their physician, who may not be good at having those conversations, but have a quality discussion with somebody trained to have that discussion along with their family member, and then measure for those patients who died, was the care that they received consistent with what their stated preferences are. We all know the kid that flies in from California not having seen mom for the last 6 months. Did we give care that was concordant with what the patient wanted? And I think that would be another critical element. Not only having assessed what patient preferences are, but also did we provide care that was concordant with those preferences?